Captain's log, stardate 6238 5.9. The T'Pau has completed its mission to support the Archimedes in helping repair the infrastructure and lend other engineering assistance to the Romulan colony on Raylon 6. We are on course to the Unroth system at Warp 6, and expect a rendezvous with the 23rd Tactical Support Wing within 2 standard days. He had no idea.
Klingons usually don't.
Do you have the personnel review?
The crew has grown suspicious.
That's usually what happens during the officer exchange program.
The Empire has no policy concerning interfleet relations.
Starfleet does, and it's strict.
Then we must be cautious.
Cautious isn't what got us here.
Are you all right?
My leg, it doesn't feel...
Hidden Frontier Productions presents Henglaar, M.D., starring John Whiting as Dr. Henglaar, Heather Ashley as Silan, Jeannie Lynn as Dr. Vonus, Timothy Fritz as Dr. Lucas Noah, and Mark Samarius as Dr. Profto. Episode 103, Risk Factors. Written by Eric Weaver. Directed by Kestra Oliver.
Ah, my 3 blunder tears. Glad to see you found my office again. New case. Captain Regard Tier, USS T'Pau. Intense acute pain. Here, catch.
Pain? That's the only symptom?
You're not curious as to why your former captain is on board, only if you heard me correctly?
If he's our new patient, it doesn't matter who he is, only what's wrong with him.
Logic test. Vonus, yay or nay?
Logically, if he...
Trick question. I don't care. But Starfleet does. His ship is participating in the officer exchange program, and the Romulans seem to like him, making Commodore Shelby's ability to get things done a lot easier. He's a dream captain. EMG, nerve conduction, and blood screen turned up nothing. He's still a screamer.
He is Trill.
Maybe there's something wrong with the symbiont.
The pain is in his extremities. Most symbiont-associated conditions are in the brain and intestines.
Agreed. This has to be a problem with the host.
So clinical and cold toward your former CO. Then you are still mad at being reassigned here.
Not important right now, Henglaar.
That's Dr. Henglaar to you.
Acute pain suggests a trauma or infection of some kind. With a trill could be as simple as a bug bite. They're extremely allergic.
Histamine count is normal. Captain Tier has a certain reputation throughout the fleet. A disease of a sexual nature would explain an acute onset of pain.
His white count is elevated.
He's a trill. Even in the symbiotic relationship, his body fights against the intrusion.
An elevated white count could also be explained by a sexually transmitted disease. Starfleet doctors frequently ignore them as possible diagnoses.
Don't Kirk, don't tell. Recheck his arteries. Do a full STD panel. Except for you, Dr. Profto. A strip for your thoughts.
Did I do something wrong?
Rule 33. It never hurts to suck up to the boss.
Should I be sucking up?
When were you going to tell me about the Conaxin drug trials?
You know about them?
I can be surprisingly aware when I choose to be. Why have you chosen to throw Latinum into a black hole?
What do you mean?
The company running that trial has yet to produce a single medical breakthrough in their 25-year existence.
The Duvian Corporation has had a pivotal role in drug treatment throughout the quadrant. Their research has led to cures for pneumonidosis, barnacoid influenza, and a vaccine for Zaret.
That's like saying you helped the band become famous because you set up the sound system. Duvian Corporation is a sham, a front to steal dumb people's money. You're not dumb.
They just need a loan to complete the Conaxin trials. 2 more years to develop a cure for rheumatic syndrome. This is a good thing. I'm helping people. It's a smart investment. I don't tell you how to live your life. Don't tell me how to spend my latinum.
Interesting.
Nurse, 1 cc of the Theragon derivative.
Oh. Okay. Sorry.
Captain, is the pain sharp or dull?
It's throbbing.
Here you go, Doctor. I think.
This will dull your pain temporarily.
Thank you. How's the symbiote? Healthy?
Our nurse is monitoring its vital signs.
Looks good so far. Reading's normal. I don't know how you walk around with that thing, though.
Nurse, that is inappropriate.
It's, okay. Tell you the truth, I don't know how I do it either. It's weird having the memories of other people floating around your mind, feeling like they actually happened to you.
Right. I mean, how do we know we're even talking to the real Captain Tyr?
I guess you don't.
How many sexual partners and from what species have you been with in the last 3 months?
Bonus!
Lucas, what is she doing?
We're just exploring all the options, sir. That's what we do.
I'm not really all that comfortable talking about that sort of thing, Dr. Fondness. Captain Radami was right about you. No filters.
If you gossip with other captains about personnel, then it is logical to infer that you also discuss matters of a sexual nature, too. How many pips will I need before you tell me your last partner?
All right. I've had 8 partners in the past 3 months. 4 humans, 2 Trills, a Bajoran, and a Romulan.
Wow.
I'll take your silence as disdain. Fair enough. But you asked. Does it help you at all?
Possibly. Bajorans carry rhonotinitis and lacera.
But symptoms for both usually present in short order. When were you with the Bajoran?
3 months ago. Just before my leave was up.
Interesting.
Whatever you gave me, it's starting to wear off.
Nurse, 2 cc's of Theragon derivative.
Oh! God! Ah! 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 My hands! I can't feel them. I can't feel my hands.
With a man of your stature in the medical community, lending his credibility and resources to our company, I have no doubt that there will be a breakthrough. Soon.
Oh, it's a very exciting prospect, Miss Galpin. The data you've sent me is both reassuring and inspiring.
Is that a representative from the Canaxon trials?
Hello?
Dr. Henglaar, you...
I want to be a part of the trial.
If you're interested in funding...
No, I have rheumatic syndrome. I'm interested in living.
You have rheumatic syndrome?
How can you be deaf with ears like that?
I'm sorry, but our process for selecting participants is highly involved. You can't just walk in.
Profto, you haven't told her yet?
Told her what?
My participation is a condition of his donation.
This is the first I'm hearing of any conditions, Dr. Profto. Is this true?
Stand by. You have no right to do this.
That's no way to talk to a dead man.
You're lying. You don't have it.
If you don't let me in this trial, I'll have you reassigned. There's a posting that's opened up near Henglaar.
Why are you doing this?
I'm dying.
Miss Galpin, Dr. Henglaar's admission into the trial is a condition of our agreement. I'm sorry to amend this late in the process, but in light of this revelation...
Dr. Henglaar, report to sickbay. Code Blue, urgent.
What have my blunted tears done now?
Pain persists, and there is now paralysis in his hands. Theragun derivative is no longer effective.
Meaning there's nerve damage. Have you checked for...
Demyelination? Twice. There's nothing that can explain this.
Just because you can't explain it doesn't make it inexplicable.
It has to be the symbiote then.
It's stable. No change in vitals.
Hey, Doc? What's happening with his abdomen? It's puffing out.
Oh, gross!
Biosealant, dermal regenerator, microsutures, stat. Where is the nurse?
I've got it.
How do you explain the symbiont bursting out of his body?
I can't. Yet.
I can't get the microsutures to take. There's too much blood.
Assist me with extracting the symbiont.
If we do that, Tyr will die. You want to explain to Starfleet why they lost a good captain?
If you don't remove the symbiont, he'll die anyway.
We don't have to choose one or the other. Stabilize Tyr until Vonus can extract the symbiont, then put it in stasis while we repair Tyr.
Do it.
Once we remove the symbiont, Tyr's isobemorine levels will drop. Once they fall below 40%, we won't be able to revive him.
Tranahaffa will maintain the isobormine levels for a day.
But the symbiont can only last in stasis for 3 hours.
Then we have 3 hours to figure out what's wrong and fix it. So, what caused his hull breach?
Vasculitis. His blood pressure spiked, and the arterial wall burst.
Due to its acute nature, it is possible the Theragun accelerated the reaction, as bioscans did not detect any sign of vasculitis.
The bioscan only rules out clotting and bacterial causes. A virus like hepatitis or encephalitis could still be a factor.
No sign of viral infection from the STD scans.
Did he reveal any salacious details about his sexual history?
He played often, but he played safe.
Good to have your shields up. Check him for mammalian bites.
Why would we do that?
Because some mating rituals are more involved than others.
Well, what about the symbiont? It could be a factor. Late life complications from joining aren't common, but they do happen. Extended space travel and alien transporters could have disrupted the symbiotic balance.
Vonus, redo the scans of the symbiont. Look for even a gram difference in any measurement.
But it was my idea.
Noah and Vonus, get to work. Profto and I have to talk. Your efforts are needed elsewhere.
I won't let you have the connection until I confirm the diagnosis.
My word should be enough.
It's for the integrity of the study. A level 4 neurographic scan will prove it.
Why do you care about integrity? You should be more interested in the dividends you'll receive when the Canaxin becomes a viable drug.
I don't want to profit from this.
But you will. Capitalism's safer on a Starfleet medical ship than on Ferenginar. What are you avoiding?
Are you comfortable with this, Lucas?
I should be asking you that, Captain. You're the naked one.
You think a bite made me sick?
A bite if you're lucky.
Wouldn't a tricorder scan reveal an infection?
It has. The symbiont. Our only clue that there's an infection is the elevated white counts.
How much time does Tyr have?
Your isobemorine levels are holding at 75%.
I mean the symbiote.
Bonus is checking on it right now.
Didn't think I'd miss it until it was gone.
Whoa! The scar on the bottom of your foot. It goes from heel to toe.
Targ frenzy.
What's that?
Dr. Noah and I were with Klingons on Delula 2. They have this competition called Targ frenzy. The Targ run at you and you have to jump over them.
I didn't even try.
I almost cleared it too, if its horn hadn't sliced my foot open. I miss you, Lucas. It's a shame what happened.
No bites, sir. You're clean.
Same here. Back to square one.
Yeah.
The time is 13:17 hours.
Computer, display patient bioscans from admittance.
Dr. Vonis, we finally meet. We need to have a little chat.
Lieutenant Cato, proceed.
The Cole is a starship, not a factory. It's not my job to build things for you and Henglaar, Profdo, Noah, and the whole sickbay team. Every time I have to modify a biobed, recalibrate a nuclear imaging scanner, make sure Henglaar's aiming a tricorder in the right direction, it takes my attention away from the Cole. And she is my top priority, not your team.
As chief engineer of a medical ship, it is certainly within your job description to provide such services.
If I can't do my job, you can't do yours. I don't have enough time in the day to be your chief engineer, too. I'll attach this stasis unit to the EPS grid, as you requested, but in the future, unless it's a warp core breach or something of biblical proportions, I ask that you not make any more requests like this.
How long will it take you to complete your work?
It'll take about 90 minutes to attach and calibrate the unit and the grid.
That is not acceptable.
Let's see. Starfleet Corps of Engineers Handbook for the Olympic-class starship, page 363. Oh, look! Starfleet Guideline 135, paragraph 4. Oh, that's 40 minutes less than the official Starfleet guidelines.
My patient will be dead by then.
That's not my problem. Do you want me to attach the unit or not?
Negative. You are dismissed.
Oh, you always hear, never trust a Vulcan whose name starts with V. I wonder why.
Stasis unit is offline.
My thoughts to your thoughts. Your thoughts to my thoughts. Tyr, you do not have much time. There is only one logical course of action.
Energize.
Oh, hello, Miss Galpin.
It's great to finally meet you in person, Dr. Profdo.
And you as well, Miss Galpin. This is Dr. Henglaar.
Very nice to meet you too, Doctor.
Under better circumstances, I'd agree.
I've brought a month's worth of Canaxin.
Thank you. Oh, and here's Dr. Henglaar's file to validate the diagnosis.
Dr. Henglaar, I'm very sorry about your diagnosis. We at the Duvian Corporation certainly hope that our product eases your pain and confusion.
If your product works, there can be no doubt.
It'll work.
Henglaar, I don't want to step on your toes or nothing, but look, you gotta follow procedure. I need to know when a surgery is happening aboard my ship.
I haven't scheduled any surgery.
Henglaar?
What the hell are you doing?
They've moved the symbiote.
Why did you do that?
It wasn't my idea. Bonus took it upon herself to.
Bonus has the trill? Inside her?
She knew we needed more time to find the answer.
If only now we could have 3 dead patients. No bites, no virus detected in Tyr. Vonis has had the symbiont inside her for 2 hours and hasn't shown any symptoms. It's the host.
Captain Tyr's got about 16 hours before his isobemorine levels become critical.
His white blood cell count is still slightly elevated.
Not that much of a surprise given that he's had major surgery to repair a severe abdominal tear.
Well, that's just it. The count hasn't elevated or dipped.
That is strong evidence of an underlying condition in the host.
Disembodied voices don't get to jump to conclusions, Dr. Vonis. Put him on a corticosteroid regime to reduce inflammation. That should minimize his pain. Follow that up with a dose of mercaptopurine.
You want to kill his immune system?
He doesn't need as much without the symbiont. We can give him whatever he needs directly. In the meantime, we're going to starve whatever the underlying condition is and get it to present itself. I can hear your eyebrow arching, Dr. Vonis. Rest assured we won't be doing the same to you and your symbiont.
So now he's our test subject, too?
2 for the price of 1. Dr. Profto approves.
No, I don't. That's torture.
Not if it gives us an answer. Treat him before.
Henglaar, are you okay?
How do you feel?
Like I've been frisked by a Nausicaan.
It's the treatment.
What treatment?
I can't say.
For my Irumodic syndrome.
Might have to call her Dr. Tear.
Hold still. This is going to hurt. A lot.
Sorry.
Just do it, man. I don't feel anything.
Give it a minute.
Dr. Noah,
Bonus.
here's the Theragun derivative.
No. There's demyelination. This is a new symptom. It's the symbiont.
Whatever you do, speak softly.
Photophobia and oral sensitivity. You've had 3 of the 4 side effects.
I always seem to defy the odds.
Tyr and Vonus won't if we don't figure out what's wrong. Vonus can't even speak to us. She's developed aphasia.
Another acute symptom.
The immunosuppressants we gave Vonus after her surgery must have allowed her to contract whatever the symbiont has faster. We should remove it. That will delay the onset of any more symptoms.
Why wouldn't you want to study the path of the disease? That's what science is. Observation.
This isn't about the drug trial. Our patients are dying.
The symbiont won't survive another surgery. Tyr dies, and Starfleet loses its Romulan emissary.
Or we keep it inside Vonus, and she dies before he does, and we don't have any answers.
I'm going to take the prescribed medicine for Irumodic syndrome. Paradoxin. In the meantime, prep Vonus for surgery. I'll inform Commander Karsten.
We're taking out the symbiont?
You're following my orders.
I cannot. Spinning. Fervent Master. Do not.
Yes, I am your master. Nurse?
Ambizine.
She's stable.
Symbiont is stable as well.
Theragun derivative standing by in case her pain surges again.
Nurse? Do you have a trash can close by in the event you vomit again?
Standing by, Dr. Henglaar.
Good. Laser scalpel.
Here, Doctor.
I'm removing the microsutures. Clear. Opening the abdomen. Dr. Profto, attach the cortical monitor.
Oh, okay.
Bonus's heart rate has increased.
Still within limits. Prepare the Neuralite probe.
This is a big risk, Henglaar. Only doctors from the Symbiosis Commission have the requisite license to perform surgery on...
Duly noted. Please refrain from speaking now, Dr. Noah. Neuralite probe.
The symbiont's vital signs are fluctuating.
It doesn't like to be touched. Can't blame it.
Oh no.
The symbiont's going into neural shock.
We're losing Vonus.
Myelin regenerator.
I'm giving Vonus the Theragun.
Not until I've stabilized the symbiont.
There, you did it.
Now?
Is the data link functioning?
Yes, Doctor. We're getting the signal. We can see the neuroactivity of the symbiont.
Theragun, now! Inserting microsutures, closing her up.
Here's the sensor data, Doctor. Do you see what's wrong with her?
Yes.
Can we fix it?
Not easily. Wake her.
She's aphasic. She's going to be in pain.
Wake her. Dr. Vaughnus, can you hear me? Good. You're carrying a Trill symbiont that has multiple sclerosis. A two-dimensional tumor 1/10 of a millimeter wide is pressing on the mesocerebrum. Symbiont nerves have no myelin sheath, so bioscans could not show the degradation. I can remove the mass, but it will require the use of directed menethium radiation therapy. You will survive, the symbiont will survive, but it will destroy your reproductive system. Do you consent?
Yes.
Here. Drink it, you idiot.
That's Dr. Idiot to you. How is she?
Recovering. Dr. Noah is prepping her for surgery right now.
Good. I stopped taking the Conaxin.
Oh, what a relief.
You are fine with it failing?
I didn't know what experimental medicine looked like. I don't want to hurt people, only help them. I withdrew my funds from the trial.
I don't have Irumodic syndrome.
You lied! I knew it! Why did you do that?
You had to see for yourself. You're an idealist, and when idealists take risks, they're really no risk at all, but instead a misguided attempt at doing the right thing. The people who take the risks are the ones who see the consequences before they act, but do it anyway.
What you did was wrong.
So, you'll give yourself meds to mimic aromatic symptoms. Risk your life even, but you won't take risks to make you happy.
Oh, I don't know. I'm about to risk shoving you out an airlock.
Try if you might, Uncle.
Surgery went well. How do you feel?
Like my old self, I remember everything, even what happened to Dr. Vaughnus. You're a better doctor than Hoberstad.
Thank you, sir. I appreciate that.
I was wrong to have listened to him. It's clear he was out to get you, so come back to T'Pau. Shelby owes me some favors. I can bump Hoberstad, make you my CMO.
It's not what I want anymore, sir. I did a lot of things on your ship that I'm not proud of, all in the name of keeping my job. It wasn't worth it. But here, this feels right for me. For now, anyway.
If you change your mind, you know where to find me. Thank you again.
Of course, Captain.
Why'd you do it, Vaughnus? You risked your life to save mine.
You are my patient. I am duty-bound to save your life.
At any and all cost?
Yes.
Henglaar said the pain was in our head. We were remembering the pain the symbiont experienced. That's not the only pain I'm remembering right now.
You would not be the only one of us experiencing such memories.
I'm glad you know about my life. I'm glad I know about your life. I was wrong about you. Everybody was.
The feelings of others are as irrelevant as my own.
You don't take risk for the good of the patient. You do it because you're not afraid to die. That's reckless.
It is not so reckless. I do not fear, therefore I do not fear death. You, on the other hand, Captain Tyr, have repeatedly jeopardized the health and well-being of your own body, as well as that of your symbiotes. You do not wish to be the host. The risks you take benefit no one but yourself. That is no risk at all. It is selfishness.
And you think risk and selfishness are mutually exclusive?
There is always a correct choice and an incorrect choice.
What if we only make the incorrect choices?
We can always make the correct one.
Subspace communication link active.
Dr. Noah, this is a surprise. How can I help you?
It's about candidate Casey Daniels. Last month, when I gave you that recommendation, It was a lie. It was a personal matter that I let interfere with my objectivity. I am profoundly sorry. Casey is... well, you couldn't ask for a better doctor. Intelligent, superb bedside manner, open to instruction, inquisitive, and daring. All the ingredients an Academy candidate needs to succeed.
Frankly, Dr. Noah, I'm distressed by what you've just told me. I'm astonished that you would allow pettiness to rule the day and influence someone's future like that, especially someone who was close to you. I really wish there was something I could do, given this new information. However, we've already made our choices. All the spots have been filled. Casey didn't make the cut. I'm sorry. Though, not as sorry as you should be. Flynn out.
Damn.
Subspace communication link active.
This is a surprise. Is that a smile on your face? Is this really Henglaar, or are you a changeling replacement?
Suppose I was a replacement.
I'd gloat about all the Ketracel white I stole during the war.
Thief!
It paid the bills.
I see that you'll be passing near the Romulan neutral zone next month. Would you care to join me for a glass of Romulan ale?
Interesting. After the last time, I thought I'd scared you off.
It was the first time I'd ever kissed a captain. I'd like to try again.
Then I'll see you next month. And wear that shirt I like. Durable out.
All right, nothing to worry about. It's just a date. What could possibly go wrong?
This episode also featured the vocal talents of Rick Pike as Commander Stu Karsten, Scott Fack as Lieutenant Ken Cato, Joe Dokes as Captain Rhaegar Tyr, Deb Wibble as Sub-Commander Solara, Susie Harbilak as Dr. Joyce Galpin, Andrew Foster as Computer Voice, Jennifer Cole as Dr. Flynn, and Melody M. Spivak as Captain Dana Russell. Theme and score by Mary Kuyumjian. Story editor Mark Painter. Editor and audio engineer David W. Hill. Medical advisor Farrell Pearson, MD. Technical consultant Jonathan Connor. Associate producer Kestra Oliver. Executive producers Rob Caves and David W. Hill. Henglaar, MD is a Hidden Frontier production.